People with mental health problems often have a hard time finding answers about their condition. That's why Dr. Jeffrey Wood of the Bay Area wrote Getting Help. It's a guide that clearly explains facts about mental health care and places to turn. Dr. Wood joins me this morning to talk a little bit about his book. Good morning. Thanks for coming by. Appreciate it.
Thank you for having me.
I guess to start off with, define mental health problems. Are those conditions that could be severe and need specific treatment, or could they be milder afflictions that may be something that the so-called average person could even face?
Great question. It affects both, actually. I mean, there are both some moderate mental health problems that, tend to go away on their own, but then there are definitely some more serious mental health issues like schizophrenia, bipolar, some types of severe depression that a person might be struggling with their whole life. Just for example, this year alone, there's going to be about 20 million American adults struggling with depressive disorders and another 20 million adults struggling with some type of anxiety.
And you outline all of these things in the book, and then you kind of have a checklist so people can kind of see how severe their problem is.
Yeah.
And taking a look at some of the things on the checklist, for example, you go put a scale of 1 to 4, but there's a 0 in there, so it's a 5-point scale.
Yeah.
Not bothering you at all the way to extremely distressing. And,
Yes.
and this is something you can kind of try to assess yourself.
Exactly. The book is designed to take the reader on a step-by-step process, figuring out what their problem is, how severe it might be, but then most importantly, figuring out what treatment is going to be most effective for their problem. Because there's no one panacea treatment that's going to treat all the problems. Treatment for depression is going to be a little bit different than the treatment for anxiety. So it's very important for the reader to figure out what their problem is so that they can go out and find the best help possible, which I outline in the book.
Now, once that being said, you go through, let's say you follow the steps and you kind of figured out where you think you are. You know where you think you are, but now you've got to go to a doctor, and I know that a lot of times it gets more complicated than that, and doctors may not follow along with kind of a self-assessed diagnosis.
Right. Well, the book is designed not to give the reader self-help treatment, but the book is designed to help you get in the door of the most appropriate mental health professional possible so that you can walk in with some type of knowledge. We need to be educated consumers, get in the door of the most appropriate mental health professional, and so you at least know what to expect when you're going in the door.
Is it important? You mentioned, for example, since we've been talking here, anxiety disorders and depression, but sometimes people can have both, and they can be intertwined, and that gets complicated too.
Very, very complicated. Most people who come in the door of a mental health professional are going to be struggling with probably more than one disorder. Very common for people to be struggling with both a substance abuse disorder and some type of depression or anxiety.
Right, they could go hand in hand, but at least this helps people kind of get it sorted out and at least get going in the right direction to get the treatment they need.
Exactly. It's designed to educate consumers so that they can find the best treatment possible, get in the door, and know what to expect when they get there.
Dr. Jeffrey Wood, thank you for coming by and sharing a little bit of insight on that.
Thank you for having me.
The book you see on the screen there, it's called Getting Help. Get you going in the right direction. We appreciate your time today.
Thank you.